Hi everyone, my name is Michaela King, and our group is going to be talking about the humanistic service provision topic. Here is a list of our participants. As the stater for the pro side, we have Carla. As the stater for the cons, we have Riley. Prover pro is Cindy. Prover con is Riley. Attacker pro is Michaela. Attacker con is Cindy. And the moderator is Michaela as well, which is myself. Here is a little bit about our topic. Like I said, we are covering the humanistic service provision. And so behavior analysts are frequently expected to work with a broad range of clients who may be faced with clients who request that they engage in behavior considered unethical based on the strict adherence to the code. Examples of this would be offering gifts, asking to be friends on Facebook or other social media platforms. And some people are for things that oppose the BACB ethics code. And we're going to discuss both sides of a few things. We're going to discuss gift giving and receiving, collaborating with others, and multiple relationships. During this debate, we will have a 6-minute time cap for each speaker. Each speaker will be required to keep their own time. As for rules for the debate, everyone must remain respectful, or I, as the moderator, will interrupt the debate and we will have to redirect from there. We do have some questions that we will be answering at the end of the debate. Like I said, we're going to be focusing on 3 topics, and these are going to be 1.11, multiple relationships, 1.12, giving and receiving gifts, and 2.01, providing effective treatment. These codes are from the 2022 Code of Ethics.
Ethical guidelines are set in place to protect consumers, ensure professional conduct, and protect the reputation of the field. With this in mind, it is in the best interest of BCBAs and other practitioners that ethical guidelines that are in place are practiced faithfully. Not only is it in the best interest of BCBAs, but their clients as well. In many cases where code violations occur, it is the client who is on the receiving end. It is imperative that we are not engaging in unethical behaviors with those we aim to serve. As Michaela stated, the 3 points we're going to touch on are gift giving, collaborating with others, and multiple relationships. Accepting gifts from a client as a BCBA can lead to forming multiple relationships. It isn't peculiar for a client to want to show gratitude to those professionals enriching their lives. However, the most ethical way to handle such a situation as a BCBA is to follow the ethical guidelines and only accept the gifts that have a set value under $10. In terms of collaborating with others, within the field, there will be instances where collaboration between colleagues from the same and other professions is in the best interest of the client. And it is best to go about it in the most ethical way possible. When it comes to rural areas, BCBAs and other practitioners in rural areas are likely to be put in positions of deciding how far they can stretch their own levels of competence when trying to meet the needs of their clients the best way possible, while still adhering to ethical guidelines. With the conflicts of interest that may arise, it would be best practice to not accept the client due to the multiple relationship, but rather consult with a colleague and refer the client elsewhere. If that is simply not possible, then be clear about boundaries of the professional relationship and ways that personal interaction could be affected. There shouldn't be any discrepancies between the client expectation and the BCBA's professional abilities.
Although ethical guidelines have been set forth for the BCBAs and practitioners to follow when working with clients, real-life situations arise that may serve as exceptions. More specifically, though we have guidelines like HIPAA in place, conflicts of interest arise frequently in real-world settings. They in return force practitioners to go against what is written in order to better serve the client and to provide interventions that are in their best interest. Ethical guidelines set forward can be overridden when unforeseen circumstances arise in real-world applications. Some instances that we're going to talk about are where a behavior analyst may be faced with clients who request that they engage in behavior considered unethical based on strict adherences to the code. Might be when the BCBA works and lives in a rural area, has to collaborate with other professionals outside of the behavior field, or is offered a gift. BCBAs may be asked to engage in multiple relationships, which is seen as a conflict of interest. However, in a small area where a BCBA may both live and treat, it may be inevitable the BCBA may be faced with this issue. It would not be practical and realistic for the BCBA to refuse to treat anyone local. Also, a BCBA may be asked to collaborate with a group of different professionals by the patient or their family, where non-behavioral interventions may be discussed, and the BCBA is asked to support these non-behavioral interventions. And if the BCBA didn't coincide and agree with these with the team, then they may no longer be invited and ruin the collaboration, even though working as a team is in the best interest of the patient. And lastly, BCBAs may also be offered gifts, and this does not fit with the ethical guidelines. However, the intention of gift giving needs to be taken into consideration because refusing a gift could cause harm to the therapeutic relationship.
Although ethical behaviors are not always easy to follow, it is our responsibility as BCBAs to make sure that our clients' needs are never compromised. The Code of Ethics was developed to guide us in making appropriate professional decisions while upholding the principles that our organization stands for. Many articles have been written to instruct us as to how to abide by the BACB's ethics codes. In this debate, I present proofs as to why we must follow the BACB's ethical guidelines when it comes to certain humanistic aspects of our job. First, I'd like to address the ethics of forming multiple relationships in rural areas. Preventing conflicts of interest in small rural areas can indeed be difficult, and at times all we can do is attempt to reduce the risk that these conflicts will take place. We should strive to limit these conflicts as much as possible. Due to this difficulty, Schenck and Scovalt, in their article entitled Dual Relationship Dilemmas of Rural and Small Community Psychologists, provide information regarding ways in which psychologists can attempt to minimize the risks of forming these dual relationships. I think that many of these recommendations can be applied to behavior analysts as well to reduce unethical behaviors. Schenck and Scovalt implied the following. 1, non-sexual overlapping relationships are not a matter of if, as much as when in the daily lives of small community psychologists. Clear expectations and boundaries, whenever possible, strengthen the therapeutic relationship. Obtaining informed consent, sticking to time limits, protecting confidentiality and explaining its limits, and documenting case progress, including being explicit about any overlapping relationships, diminish the risk of misunderstandings between client and psychologist. Number 3, ongoing consultation and discussion of cases, especially those involving dual roles, provide a context for psychologists to get additional perspectives and decrease the isolation that sometimes accompanies rural and small community practice. Number 4, self-knowledge and having a life outside of work lessens the chances that we as psychologists will use, even unknowingly, our clients for our own gratification. Remaining ethical when collaborating with providers from other fields is another important ethical consideration. We must be ethically bound whenever we work with other providers to ensure that we only represent ourselves with scientifically backed and proven interventions. When collaborating with other professionals, we might disagree as to whether or not a treatment proposed represents an effective behavioral intervention or represents any effective type of intervention at all. In Broadhead's article entitled Maintaining Professional Relationships in an Interdisciplinary Setting, Strategies for Navigating Non-Behavioral Treatment Recommendations for Individuals with Autism, Broadhead writes, after the non-behavioral treatment is identified, it is important to ask whether or not client safety is at risk. Risk to client safety can be defined as any treatment that will likely cause short or long-term psychological or physical harm to the client. Broadhead then goes on to discuss past treatments that have caused harm to patients, such as chelation therapy, and ineffective treatments such as facilitated communication. We must always strive to put the needs of the client first. This means we must use and promote ethical treatments at all times, even when we are collaborating with others. Broadhead provides us with a decision-making model to guide us in determining whether or not we need to argue our points regarding non-behavioral treatment suggested by others during the collaboration process. Third point is accepting gifts. The ethical consideration of either accepting or not accepting gifts from clients' families. As an individual who has been practicing the field of ABA for many years, I have had parents on ample occasions attempt to provide me with a gift. When I first began working as an RBT, I was told that I was not to request for or accept a glass of water from a client and should not request to use a client's bathroom. I was told that it is our obligation to take care of personal needs before we arrive at the client's home. The current BACB ethics code states that we must always refrain from accepting gifts from our clients due to the fact that this action could cause multiple relationships to form. Accepting a gift could have unspoken implications and create multiple relationships that are unethical in our profession. Since it can be difficult to tell a family that you are unable to accept a gift they're offering you, or they've gone out and purchased, it is best to inform the family at the beginning of services that you cannot accept gifts. Witz et al. Recommended use of this strategy in their article, Behavior Analysts Accept Gifts During Practice. So now what? Bailey and Birch, who wrote our textbook, Ethics for Behavior Analysts, recommended the following: having the parent guardian party sign a declaration of professional practice in which the expectations are described before services begin is a good way to lay out the groundwork for ethical service provision. It should be pointed out that with the new codes that are coming in 2022, BCBAs will be allowed to accept gifts up to $10 in value. This does not indicate that we will be able to accept all gifts. Instead, the BACB set a monetary limit for us to abide by.
As my position, I'm going to discuss the reasons why you might not follow these guidelines. The first one, as the data in the following articles show, access to quality care for children with ASD has been shown to be scarce in rural areas, with most children not having their needs met. With the growing prevalence of autism, along with the lack of BCBAs, children in these rural areas deserve quality care, even if it involves multiple relationships. Where care is needed, these multiple relationships are inevitable. These children will deserve the care they need. On the next slide is a map that shows the availability of BCBAs. And as you can see in this map, the prevalence is very low, especially in the central US area. The next point I want to bring up is about collaborating with providers. Through the involvement of other professionals, the client has access to a more rounded treatment plan, which could increase the success of outcomes. The article written by Broadhead shares that there is an increase in the use of behavior analysis with individuals with autism. A behavior analyst may find themselves working in a setting that involves an interdisciplinary team that requires multiple disciplines to collaborate. This could be things like speech or occupational therapy, or maybe physical therapy. While part of the interdisciplinary team, non-behavioral treatments may be recommended from others, which places a behavior analyst in a position to either offer an alternative behavioral-based treatment or question the non-behavioral treatment. Broadhead states that the excessive questioning or critiques of non-behavioral treatments by the BCBA may unintentionally erode professional relationships between the BCBA and their non-behavioral colleagues. This is not an ideal circumstance when improving the outcomes of individuals with autism is the end goal. Broadhead offers a decision-making model to assist BCBAs, which can be seen on the next slide. So this is the decision-making model he refers, and this tells you when and when you should not intervene with recommendation of non-behavioral interventions. The next thing I'm going to discuss is accepting gifts. While gift giving could lead to multiple relationships, in some cases refusing the gift could damage the relationship between the giver and professional. Common considerations for receiving gifts include the client's culture, the intention of giving the gift, and the monetary limits. The APA does not have a specific guideline on receiving gifts and refers to cultural reasons to justify ethics. 77% of practitioners view not accepting gifts would have been offensive to the giver for culture or therapeutic reasons.
So, as we all know, the ethical code was written with the well-being of clients in mind. Each code is meant to hold us accountable and respectful of our clients. One of the codes includes refraining from forming multiple relationships. The opposing side argues that due to difficulties in finding services, multiple relationships within rural areas should be allowed. And according to our code of ethics, this is simply not ethical. There are multiple ABA companies throughout the country who are working diligently to provide services in underrepresented communities. One example of this is a company called Autism in Motion, or AIM. And AIM's mission is to bring ABA services to places that it hasn't been before. And by that, I mean they find smaller towns and things like that away from those giant cities, so that people can get services easily. It just makes it more accessible. And then another option is telehealth. So telehealth is something that a lot of us didn't really have a lot of experience with until recently. But due to the pandemic, most of us have had to work with telehealth rather than in-person services for protection. And it's not always the easiest solution, and it's not for everyone. But there's also a shortage of people in the ABA field. And by utilizing telehealth, we're able to reach people in those rural areas that we haven't been able to before. This is just a little bit of help to determine like who is actually the ideal person for telehealth. There are some minimal things that you have to think about, like attending. That's going to make it a lot easier if the child can attend to what you're doing, what you're saying. They're going to get more out of it. Less prompt dependency, things like that. You want to have like a child that has lower frequency of problem behaviors, lower intensity. However, as long as you have the parent on board and are able to do those caregiver coachings, it is possible to do telehealth with just about anyone. It's just a matter of how much help, how much coaching are the parents going to need, how much time is the parent going to have to dedicate to helping with telehealth. So another thing that I want to talk about is collaborating with other providers. So the opposing side believes that it's okay to agree with other professionals on non-behavioral interventions when collaborating. According to our ethical code, all of those practicing ABA must work within that defined role and within the scope of competence. This is not the case if the behavior analyst is promoting a non-behavioral intervention for a client. Now, and when I say that, I mean, yes, you can listen. Yes, you can, understand what other people are saying and their ideas. But when it comes to what we're recommending, what we're approving, we can only do that with things within our scope of competence. Let's see. The last thing is gift giving or receiving. So the opponent to the ethical code states that it could be offensive to refuse gifts from clients and their families. As we have all been told throughout our careers, we are to avoid multiple relationships at all costs. By refraining gift exchanges, we are working on a professional rather than a personal relationship. The opposing side does not seem to be concerned about multiple relationships. However, according to Bailey and Birch, multiple relationships could be harmful to the client. When a multiple relationship is formed, objectivity is left impaired, which means the treatment of the client is no longer ethical.
Well, as practitioners, we are ethically bound to avoid multiple relationships. There may be cases where this could be inevitable, especially with lack of resources in rural areas. The recommendations made by Schenck and Schofield could still be applied to set boundaries between client and provider in these rural areas, even if multiple relationships are present. With the lack of resources in these rural areas, along with the growing prevalence of ASD, these clients deserve the best possible care, even if it may not align with our ethical guidelines. It would be unfair to refuse care to a client in need simply because they can't afford to seek care in another community or due to their chosen location for living. We must be flexible to ensure all individuals in need are receiving the care they need to improve their quality of life. The main argument posed against collaboration focuses on safety of the client. However, as we have seen in previous articles, oftentimes there is a lack of services available to these clients, specifically in rural areas. Additionally, if we see a treatment that could be potentially helpful to a client, it should be considered as long as it is within the bounds of client safety. As practitioners, we should want the best care for our clients, regardless if it is a field we are competent in. We should trust other professionals and work with them to alter the plan of care to align with both client safety and science in mind. If a professional recommends a treatment of care that has been useful in the past and has a reasonable amount of research tied to it, then that treatment might be worth considering. There are many good, worthwhile treatments out there that will show promise and are on the way to being approved, but are being hindered by the requirement for too much research. How much research is really needed to prove an effective treatment? Well, the BACB ethical code does state against accepting gifts in order to avoid multiple relationships. They fail to recognize any type of cultural variables that may be present for that client and their families. The APA is one organization that has recognized these cultural differences, which paves the way for our ever-evolving field. If the BACB ignores these cultural variables, this may lead to harming the relationship between the professional and the client, which could hinder progress in treatment. Additionally, as professionals, we recognize the importance of culture in our treatment. So why would we ignore this when it comes to gifts as well? The pro-ethics group wants us to believe that all situations are equivalent, and there is only one side to the picture. I would like to argue that there is always a need to address every situation individually and ethically in regards to what is the right thing to do. Whether it comes down to accepting a gift from a client who is just beginning to trust you and the services you are providing, helping a special needs individual in a rural community obtain much needed services, or working with a team to promote the best interests of a client. Sometimes we have to decide morally and ethically what the best course of action should be. We are humans, not one-size-fits-all people who do not require their individual needs to be considered.
Yes, I can agree that culture is important. However, as a BCBA, it is vital to follow the norms of the professional culture as well. And that is to follow the guidelines set in place. It is best practice to only accept gifts under the value assigned by the BACB. When collaborating with others, it is stated that all those practicing ABA must work only within a defined role and within their scope of competency. And with that, we can only utilize empirically supported treatments. In the real world, special circumstances arise that may force the BCBA to stray from the ethical code. However, unexpected situations arising still make it imperative to keep up to date with the guidelines, as well as remaining informed. When dealing with clients, set clear boundaries in order to avoid any confusion later. It is up to the BCBA to remain well informed of the guidelines and operate within their scopes of competency only.
It is apparent that these ethical guidelines were set in place for the overall good of the field of ABA and for the clients and for the behavior analyst. However, it is nearly impossible to encompass all of these what-if scenarios. In the moments that a behavior analyst may be asked to violate the codes or the codes of ethics when creating them. Based solely on just this debate, it is best to follow the ethics codes at all times, except under extreme and special circumstances where the good outweighs the bad when violating the ethical code. When treating and a behavior analyst is faced with potentially having multiple relationships, the behavior analyst must treat with caution. Additionally, behavior analysts should only provide services if the therapist is able to remain professional and separate the two roles and relationships. The therapist should not provide services to close family and friends because the professional boundaries will be difficult to follow. Breaking this ethical code only appears to be appropriate if there seems to be no other options for the client. That includes even if telehealth and other options like that wouldn't work. This only seems appropriate if the multiple relationship is with someone who is viewed as an acquaintance or less and is not with anyone that the behavior analyst has a close relationship with. As for when collaborating with professionals, it is important that the behavior analyst be a team player and work in the best interest of the client. The behavior analyst should only speak in regards to the behavioral interventions. If faced with being asked to support non-behavioral analytic interventions, they should kindly remind the group that the interventions are outside of their field of practice and competence. The behavioral analyst does not have to disagree and shut down every single non-behavioral intervention, but they also should not encourage and present non-behavioral ideas. In the end, the group of the professionals are there to collaborate and establish a combined intervention approach in the best interest of the client. And they're just there to defend their practice and put what they are learned and taught into the plan for the child and bring in their expertise. As for accepting gifts, though, it is very a wise decision to establish the rules and boundaries at the beginning of a therapeutic relationship. This could be completed in a written contract that is signed with both parties. If a behavior analyst is still faced with being offered a gift from a client, then the BACB is now changing the rule and has allowed the guidelines to be accepting a gift of $10 or less. Being able to accept a smaller gift and having set boundaries prior to starting treatment should aid in not offending clients and dishonoring their culture. If offered gifts above a $10 value, then the behavior analyst should remind the families of the contract they signed and how it could result in the behavior analyst no longer being able to treat that client and losing their license. Carla's muted. There you go.
Well, we have some questions for you guys. Sorry for the technical difficulty. The first question being, what would you do when faced with someone using a non-behavioral based intervention plan? Well, non-behavioral based treatment plans are not within our scope of competency or practice. So as a BCBA, you should inform the person to only utilize practices that are empirically backed. The second question is, if you lived in a small rural town and your child needed services to treat their SIB, would you be concerned about multiple relationships? Also, would you think twice about asking your sister-in-law to treat your child? Well, it is too much of a conflict of interest. When you are that close to a person, it is impossible to separate roles. It could cause tension in the personal relationship and could potentially cause harm to the client or his treatment. Now, do any of you have any personal experiences with these ethical codes?
So I'm going to go first. I have a cool experience regarding collaborating with other professionals. Where I work, they offer this idea of 360 services. So when a child comes to the center, they can receive all the services that they might need. Specifically, it's ABA services, speech therapists, physical therapy, and occupational therapy. However, all the professionals do collaborate and they kind of discuss everything that they're working on with the child or the things that they notice about the child or things they like. And they do work together as a team with the child and with the parent. However, each professional writes their own plan of care. So the speech therapist writes their own plan with their own goals and what treatment they're doing. The occupational therapist does the same. And then also for ABA, although we know about the physical therapy and speech therapy services the child may be receiving, we write our own plan of care regarding behavioral services, and we do not recommend anything regarding other services. And I think this is a great way for teams to collaborate and share what they're doing and working with and what they notice. but also a good way not to go out of your scope of practice.
And I'm going to talk a bit about an experience I have with multiple relationships, but also going along with that, gift giving or receiving. So I have a client that I've worked with for a long time, and I do his home sessions as well. And he has, very sweet family. The family, every time I'm there, it seems like I'm being offered, food, drinks, things like that, and I have to remind them, I, I'm not allowed to do that. That's against like our ethical code. I do appreciate it, but I can't do that. Recently, I've also been offered a gift by the family, which was a book about a religion. And of course, I said, I can't accept gifts. However, the more I thought about it, if I had accepted this gift, say I took this book on religion, say I read the book, and what if I didn't agree with it? What if it wasn't within my beliefs? If the parents then asked me about it and I have that conflict, not only the conflict of interest of having that, shared relationship, but also then we have a religious conflict and things like that. So just by accepting that book, things could have really taken a turn for the worse. So I'm thankful for our ethical code. It gave me something to not only to just know and keep in the back of my head for don't form the multiple relationship, things like that, but it also helped me, and I think the family, for me to have that to fall back on, to not say, no, I don't want your stuff. It was to say, that's against my code of ethics that I am required to abide by. I think that really helped myself and the family, and I'm very glad that I chose to refrain from accepting the gift because I don't know how that would have turned out. So thankful for the code of ethics on that one. But thank you all for watching our debate. I hope you all enjoyed it, learned a lot. Have a great rest of your semester. Thank you.
Thank you.
Oh no.